her like what her name is and all that stuff?
No.
Oh, okay, we know. All right. Okay, Andrea. So, tell us about the role of navigation. Why is it important, and how do you help patients?
So, Breast Navigator, I think, is a key team player when somebody's been diagnosed with breast cancer. I often like to think of it, and I think we can all understand that many times when a woman is diagnosed with breast cancer, not only herself but her whole family feels like their world has been turned upside down, and they're faced with a lot of decisions and new information that they don't know what to do with, so it makes them some days feel like they're drowning. And so I like to think of a navigator as a life preserver. And we do that through education and communication, and we advocate for our patients. So when we empower patients with education, it helps them be active participants in their treatment planning. And so I think that's a really key role. Women come in to see us and they don't know what cancer means, and just being able to sit with them and give them some information about the treatments that are going to be involved really helps them be engaged. I think too, as navigators, we're able to learn a lot about our patients, and I think this is one of the biggest privilege to be a navigator, is that we have the opportunity to meet a patient and their family when they're at their most vulnerable. They often have just learned that they have breast cancer, and that's really all that they know. And so they come in to see navigation and they're scared, and they've let all of their other maybe life worries or day-to-day kind of to-do lists, they realize that that no longer matters, that their health is what's most important. And so it's like their walls just come down, and navigators are just so blessed to be able to meet people where they're at. And that is such a gift, because we are able to truly understand what's going on in a person's life, so that we can identify potential barriers to care, whether that's just something as simple as we've got a working mother that doesn't know how that's going to fit in with her cancer treatment, or maybe we've got a mother that's just has a young child at home, and who's going to take care of the baby when she's going to chemo. We've got ladies that life has got a lot of things going on, and navigators are really able to get in there and understand. And I think most importantly, we hear our patients. And that's so important, because if we can hear what our patients have to say, what's important to them, to help them stay on track with life goals that are important to them, in addition to going through chemotherapy or surgery and their cancer treatment, then we've done an amazing job. We've delivered personal health care, and that's what every single patient deserves.